When a loved one is diagnosed with a serious illness, doctors treat the condition, but what about how the patient feels and what the family is experiencing? Dr. Stephen Beckenek, Director of Seton Palliative Care, is here to talk about a relatively new specialty that focuses on everyone involved. Good morning to you.
Good morning. Thanks for having me.
Thank you for being here. So this is about the entire family unit, beyond the patient.
This is our job in palliative medicine is to take care of patients as well as family members. And so what we do is we try to prevent or alleviate suffering as people go through serious illness. We also we recognize that family members also go through a difficult time as the patient's going through this journey. We take care of them as well. So we tell people that we do three things. We help manage symptoms like pain, shortness of breath, nausea and vomiting, anything people feel as though they're being distressed by as they go through their illness. We act like the communication and education team in the hospital, so we have very time-intensive family meetings with folks to make sure that we're all on the same page and all their concerns and questions are answered or addressed. And then we take care of family members as well, because we recognize that they wind up having these caregiver syndromes as the patient goes through the illness.
Now, how long has this care been in place at Seton?
We're a relatively new specialty. We were first recognized in 2006, and that's when Seton started the program.
What are some of the benefits that you guys are already seeing from this type of care?
So what happens when we inject our specialty at the beginning of a diagnosis? So someone gets lung cancer or someone gets congestive heart failure. We see increased quality of life scores go up. So we see distress go down. So depression, pain, and other symptoms, those decrease. We see healthcare utilization change in a positive way. And very importantly, we see people live longer. And so the earlier that we can get involved in someone's care, the better they do.
Does a family need to request this if they have a family member who is hospitalized, or how do you guys find those families?
Right, there's different ways, and so doctors oftentimes call us in. Nurses and social workers usually recognize the need for our role long before anybody else, and family members and patients can request us as well.
Well, Dr. Beckenek, we are already out of time, but thank you so much for coming in this morning. We're going to have more information about palliative care on our website at kxan.com a little bit later this morning.